to all. My name is Senali Veera Perura and I will be presenting a rare and fascinating postpartum reproductive disorder in a dog, which is uterine body intussusception, based on a clinical case report. Now let's begin with a brief introduction to the condition. During the postpartum period, complications such as retained placenta, metritis, subinvolution of placental sites, and uterine prolapse or rupture are relatively common. However, uterine intussusception is extremely rare, with fewer than 10 cases reported worldwide. This case involves delayed uterine involution due to the invagination of the uterine body into its distal segment. To understand the patient's situation better, let's move on to the case details. It was a 4-year-old German Shepherd bitch, nulliparous, and had delivered 13 healthy puppies 27 days ago. The owner reported reduced appetite for 2 days, periodic tremors, and hemorrhagic valvular discharge. She was still nursing the litter at the time of examination. Upon clinical examination, vital parameters including temperature, heart rate, and respiration were normal. However, abdominal pain was detected on palpation and bloody valvular discharge was present. These findings indicated that postpartum recovery was not progressing normally. To further investigate, diagnostic tests were carried out, starting with vaginal cytology. A vaginal smear was prepared and examined. The smear showed parabasal cells, red blood cells, and importantly, polynucleated trophoblast cells. These cells are normally present for up to 2 weeks postpartum, so their continued presence suggested a delay in uterine involution, initially resembling subinvolution of placental sites. Transabdominal ultrasonography was also performed. It revealed a multi-layered hypoechoic structure located in front of the urinary bladder, which is consistent with uterine intussusception. This imaging finding was crucial to make the diagnosis. Next, laboratory tests were evaluated to rule out infection. Blood testing, including CBC and biochemical parameters, showed no abnormalities. The dog was also tested negative for Brucella canis and Canine herpes virus, ruling out common infectious postpartum complications. With the diagnosis confirmed, surgical intervention was planned. Laparotomy was performed. The surgical team found the uterine body invaginated into its distal section and partially into the cervix. Because adhesions had formed, manual repositioning failed and therefore an ovariohysterectomy was performed to resolve the condition. After surgery, post-operatively, the dog was treated with amoxicillin clavulanic acid for 5 days. She recovered well and the sutures were removed 10 days later. There were no complications during healing. Let's now discuss the significance of this case. This case highlights a very rare condition. The presence of a large litter likely caused overstretching of the broad ligaments and contributed to intussusception. Prolonged bleeding and abdominal discomfort during puerperium should never be ignored. Early ultrasonographic diagnosis may enable treatments that preserve fertility, unlike in this case where removal of the uterus was required. To conclude, uterine intussusception is a rare but serious postpartum complication in dogs typically linked to poor uterine involution after whelping. Risk factors include dystocia, retained fetal membranes, excessive uterine stretching, and improper obstetrical handling. Awareness, early recognition, and prompt treatment are essential to safeguard the health of the dam and preserve her future reproductive potential. Thank you for your time and attention. I hope this presentation has been informative and insightful.